Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth. The main cause of periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. It's hard to see plaque, but look at how it shows up after we've stained it with red dye. The blue spots here are tartar. Tartar, which is also called calculus, is plaque that has built up and mineralized. Periodontal disease develops when plaque and bacteria invade the crevices between the teeth and gums. Bacteria, like the ones shown here, produce toxins, and it's these toxins, combined with your body's reaction to them, that destroys bone around your teeth. Once bone has been lost, it never grows back. When too much bone is lost, there's so little support for the teeth, they get loose and have to be removed. If you have periodontal disease, you may have some of these warning signs: persistent bad breath, bleeding of the gums when brushing or flossing, soft, swollen, or tender gums, gums shrinking away from the teeth, loose teeth, and changes in the spaces between your teeth that reflect changes in the underlying bone. You may also have none of these warning signs. In fact, most people who have periodontal disease aren't even aware of it. Since you may have no symptoms with periodontal disease, we perform a thorough examination with a periodontal probe and X-rays. With periodontal disease, the bone level falls and the gums pull away from the tooth, forming a pocket. We measure the pocket from the bottom of the pocket, where it's attached to the tooth, to the top of the gums. A probe reading of more than 3 millimeters is a sign of periodontal disease. Bleeding is also a sign of infection. These are healthy gums. They're tight against the teeth, there aren't any pockets, and they don't bleed. Now notice the difference with early periodontal disease. In general, the deeper the pockets, the greater the spread of periodontal disease. In this case of moderate periodontal disease, we see the red and swollen infection of the gums. Look especially close at the difference of the gums between the teeth. This is where periodontal disease usually starts. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are, compared with the healthy mouth. And notice the tartar on the teeth. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Once we've found periodontal disease, we'll talk with you about treatment options and proper home care to minimize bone loss and restore the health of your gums. The goal of root planing is to eliminate the source of periodontal infection by removing the plaque, tartar, and bacterial toxins from the root surfaces. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Routine cleanings remove plaque and calculus from above the gum line. Root planing removes plaque and calculus from below the gum line. To keep you comfortable, we usually numb you before root planing begins. Using instruments like these, we carefully and meticulously plane the root surfaces. Once the source of infection is removed, your gums begin to heal. As they heal, your gums will tighten around your teeth. Home care is the key to keeping this healing going. Since brushing and flossing only go about 3 millimeters below the gum line, something more is needed to clean the deeper pockets of periodontal disease. We'll give you the tools and techniques to do it as part of your treatment. Normally, we spread root planing across several appointments. This way we can check the healing and help you fine-tune your home care efforts. A microscope is a new tool to dentistry that really helps in the treatment of periodontal disease. The bacteria that cause periodontal disease thrive below the gum line. To look at the bacteria from a person's mouth, we take a small plaque sample from a pocket and place it on a slide. This is a slide from a healthy mouth. This is a slide from a mouth with active periodontal disease. These are spirochete bacteria, and they're one sign of active periodontal disease. You'll see your own slides when we use the microscope to help you judge the success of your own periodontal treatment. That way, you may be able to see the return to health in your own mouth after root planing. Periodontal disease is an infection of the teeth, gums, and the bone that surround the teeth. It's caused by specific bacteria that live in the deepening space between the tooth and gum that's called a pocket. The bacteria that cause periodontal disease trigger the body's immune system to produce enzymes. And it's these enzymes that actually cause the bone to be lost. If left untreated, this destruction of supporting bone eventually leads to tooth loss. Periodontal disease is in fact the #1 cause of adult tooth loss. The traditional treatment for periodontal disease has always included a series of steps, starting with the removal of plaque and tartar from the root surfaces. This is called root planing. After healing, the areas are reevaluated, home care techniques are modified, and in severe cases, surgery is recommended. Recent breakthroughs have led to the development of another effective tool in the ongoing fight against periodontal disease. It's called Periostat. This is Periostat. It's taken not for its antibiotic effect, but for its inhibiting effect on the bone-destroying enzymes that are released by the body as a result of periodontal disease. We usually prescribe Periostat for a number of months. It's normally taken twice a day, 1 capsule in the morning and 1 in the evening, about an hour before meals. When used in combination with root planing and new home care techniques, Periostat reduces pocket depth, inhibits the destructive enzymes that cause bone loss, and promotes a healthy gum-tooth attachment. We won't prescribe Periostat if you're allergic to tetracyclines, pregnant or nursing, or for infants or children under 8. Periostat, an important new medicine that we recommend in combination with root planing and new home care techniques to help stop the ongoing damage caused by periodontal disease. Periodontal flap surgery is necessary when pockets and infection still remain after root planing. After making sure all the areas are completely numb, we gently separate the gums from the tooth. This creates a flap and gives us access to the infected areas. We then remove any plaque and tartar from the root surfaces. The area is reshaped, and the gum line is adjusted to make it easier for you to keep the teeth plaque-free. Any soreness after surgery can usually be handled well by mild pain medication. Periodontal flap surgery removes the source of infection, reduces the size of the pockets, makes cleaning easier, and raises your overall level of health. When everything is healthy, your gums are snug against the teeth, and the root doesn't show. Unfortunately, in some cases we see something more like this. The gums have pulled away from the tooth, and some of the root surface is exposed. This apparent lengthening of the teeth can really age a person's smile. If left uncorrected, the loss of protective gum tissue may also mean even more severe problems down the road. Fortunately, a procedure called grafting can correct this problem. The first step in placing a graft is to thoroughly numb the involved areas. Then the graft is taken from the donor site on the palate. In some cases, the incision heals on its own. In other cases, it's closed with a stitch or two. At the site of the graft, we gently separate the gums from the tooth. This creates a flap and gives us access to the area. We then carefully remove any plaque and tartar from the root surfaces. The graft is strategically placed and carefully stitched in place. After healing for a few weeks, the grafted tissue blends in beautifully. The results? The gums have been restored and strengthened, the root surface is covered and protected, and the tooth now has a much more natural and pleasing appearance. Healthy gums, tight against the necks of the teeth, are an important part of a beautiful smile. But sometimes a problem like this can develop. As the gums extended onto the front surface of the teeth, the natural balance between the length of the teeth and the height of the gums was lost. The first step in a gum reduction procedure is making sure that all of the involved areas are completely numb. We then carefully make a small incision and remove the excess gum tissue. After a couple of weeks, the area will be completely healed. Notice how much more natural this area looks after the procedure. A gum reduction procedure is a safe and predictable way to remove excess gum tissue and improve the natural appearance of a person's smile. When a tooth is broken down due to decay or fracture, a crown is an excellent way to cover and protect it. In cases like this, when the damage is more severe, there may not be enough remaining tooth structure to adequately support a crown. Years ago, a tooth like this would have to be extracted. But today, by using a procedure called crown lengthening, we can increase the amount of available tooth structure and save the tooth. The first step in this procedure is thoroughly numbing the entire area. Incisions are placed and the gums are gently pulled back. The area is then reshaped and sculpted to the desired shape. The gums are replaced and a couple of stitches are placed to speed healing. After a few weeks of healing, a crown is placed to cover and protect the damaged tooth. Crown lengthening is a minor surgical procedure that is a predictable and effective way to save a tooth that might otherwise be lost. If you have periodontal disease, your choices are limited. You may choose treatment or to delay treatment. Treatment involves a combination of root planing, new home care techniques, more frequent dental cleanings, and in severe cases, surgery. Delaying treatment will never make periodontal disease go away. Periodontal disease is an ongoing degenerative disease. Bone lost never grows back. If too much bone is lost, teeth get loose and have to be removed. This means you may end up wearing partial dentures or even full dentures. You don't have to lose your teeth to periodontal disease. Treatment removes the infection and keeps the disease under control. By now, almost everyone knows that cigarette smoking has been linked with lung disease, cancer, and heart disease. But most people aren't aware of the effects of smoking on their oral health and its role in increasing the risk of periodontal disease. Smokers are more likely to have calculus, which is plaque that hardens on your teeth, deep pockets between your teeth and gums, the loss of bone and tissue that support your teeth, and chronic periodontal disease. Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth. To understand how smoking increases your risk of periodontal disease, it's important to understand how the disease develops. The main cause of periodontal disease is plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. You must remove all of the plaque each day, or it builds up and mineralizes to become tartar, which is also called calculus. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. Bacteria that thrive in plaque and calculus produce toxins, and it's these toxins, combined with your body's reaction to them, that destroys bone around your teeth. Smoking helps cause periodontal disease in several ways. It reduces the amount of saliva production, and therefore the number of disease-fighting antibodies that are in saliva. Lower saliva production also causes increased plaque and calculus formation, and it damages your immune system, causes blood vessels to restrict throughout your entire body, which reduces blood flow. Since your body needs white blood cells to fight off infection, the reduction in blood flow to your gums makes it more difficult for your body to fight the disease-causing bacteria in your mouth. Besides contributing to the onset of periodontal disease, continuing smoking after your treatment makes it much harder for your gums to heal. To successfully treat periodontal disease, we remove all of the plaque and bacteria from your teeth. It's critical for you to then maintain a plaque-free mouth. The reduction of saliva caused by smoking makes that job much harder. As we've learned, if you're a smoker, your immune system may not be up to the task. There are more than 4,000 chemicals found in cigarette smoke, including formaldehyde, carbon monoxide, ammonia, and arsenic. The bottom line? Smokers are 4 times more likely to have advanced periodontal disease and twice as likely to lose their teeth. So if you haven't yet considered quitting smoking, now you know another benefit. By becoming a non-smoker, you can strengthen the fight against periodontal disease and keep your teeth. Periodontal disease, an infection of the teeth, gums, and the bone that surround the teeth, is the #1 cause of adult tooth loss. Periodontal disease begins when plaque, the sticky film of food and bacteria, builds up. If the plaque is not removed, it hardens into calculus, also called tartar. The blue spots here are tartar. The buildup of plaque and tartar dramatically increases the number of harmful bacteria in your mouth and can result in deepening spaces between the tooth and gum called pockets. The bacteria also trigger your body's immune system to produce enzymes. It's these enzymes that destroy the bone around your teeth and ultimately leads to tooth loss. To fight periodontal disease, we need to remove the plaque and calculus and reduce the amount of bacteria in the pockets in your mouth. One device that we use to remove calculus from teeth is called an ultrasonic scaler. It consists of a wand with a small scaling tip that produces a soft ultrasonic vibration. The small, quick vibrations in combination with a gentle water flow give us a whole new level of effectiveness in calculus removal. The benefits are increased efficiency of calculus removal, less need for hand removal of stubborn deposits, and the small tips allow more comfortable access to root surfaces. The ultrasonic scaler thoroughly removes calculus while decreasing the number of destructive bacteria from below the gum line. It's an important tool in the prevention and treatment of periodontal disease. Gingivitis is a swelling and discoloration of the gums. There is usually no pain or discomfort associated with gingivitis. It's the mildest form of gum disease, and its effects are reversible. However, gingivitis can be the gateway to periodontal disease, a much more serious condition which can lead to irreversible bone loss and eventually tooth loss. The main cause of both gingivitis and periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. You must remove all of the plaque each day, or it builds up and mineralizes to become tartar. The blue spots here are tartar. Bacteria that thrive in tartar produce toxins. It's these toxins, combined with your body's reaction to them, that destroy bone around your teeth. Once bone has been lost, it never grows back. When too much bone is lost, there's little support for the teeth. They get loose and have to be removed. That's why it's vital that we treat gingivitis early before it can progress. Though most people aren't aware that they have gingivitis, the warning signs are redness where the gums and teeth meet, swollen gums, bleeding when brushing and flossing, and bad breath. To determine whether or not you have gingivitis, we'll perform a thorough examination. We'll look for any changes in gums shape, color, and contour, and bleeding in the gums upon probing. If we determine that you do have gingivitis, treatment always includes a professional cleaning which removes plaque from teeth, as well as a consistent home care regime and a revisit schedule. In some cases, additional steps are required, which could include using a disclosing solution to determine where the plaque is, a review of the proper use of a manual or electric toothbrush, the use of dental floss to clean between teeth, and using an antibacterial rinse to help kill destructive bacteria. It's important to catch and treat gingivitis early before it progresses and results in the bone loss of periodontal disease. If you are diabetic, you're at a greater risk of suffering from oral infections and diseases, including periodontal disease. Why? Because diabetes frequently causes blood vessels to thicken and become less elastic, which decreases the flow of oxygen and nutrients to the body's tissues and slows the removal of harmful wastes. This can weaken your mouth's resistance to infection. Also, the harmful bacteria in your mouth that are responsible for periodontal disease thrive on sugars, including glucose, the sugar linked to diabetes. If diabetes isn't controlled properly, high glucose levels in your saliva feed these bacteria and set the stage for gum disease. And interestingly, the reverse is also true. An infection in the gums makes it more difficult for you to control your blood sugar. Gums infected with periodontal disease are toxic reservoirs of disease-causing bacteria. The bacteria hide in pockets next to the teeth, where the gums have pulled away from the tooth surface in response to the infection. Diabetics who don't successfully control their blood sugar levels also often experience a decrease in the flow of saliva, which can lead to a condition called dry mouth or xerostomia. Having a dry mouth may seem to be nothing more than an irritation, but it can cause some serious oral health problems. A lack of moisture in the mouth allows plaque, the sticky film of food residue and bacteria, to build up on teeth. And plaque accumulation is the main cause of periodontal disease. It's important for everyone, especially diabetics, to remove plaque from their teeth each day by flossing and brushing, and to visit us regularly, or it may build up and harden to become tartar or calculus. To help prevent bacterial infections in your mouth, we may prescribe antibiotics, medicated mouth rinses, and more frequent dental cleanings. With good dental and medical care, your gums and teeth can remain healthy and free of periodontal disease. Throughout your pregnancy, you'll be hearing a lot about how your health affects your baby's health. Now, researchers have discovered that women with periodontal disease are 7 times more likely to deliver a preterm, low birth weight baby than women with healthy gums. The main cause of periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. You must remove all of the plaque each day or it builds up and hardens to become tartar, which is also called calculus. The blue spots here are tartar. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. If it isn't removed, it gets onto the root surfaces of your teeth, where it can cause pockets to form in your gums, trapping bacteria. The bacteria, like the ones in this slide, produce toxins, and it's these toxins combined with your teeth's reaction to them that destroys bone around your teeth. Scientists believe the link between periodontal disease and preterm birth is due to the body's reaction to the bacteria that exist in the infected gums associated with even mild forms of periodontal disease. Gums infected with periodontal disease are toxic reservoirs of disease-causing bacteria. These bacterial toxins attack the gums, ligaments, and bone that surround your teeth, creating infected pockets that are similar to a large open wound within your mouth. This creates a doorway to your bloodstream, where bacteria can enter and travel throughout your body. Your body reacts to this infection in your gums by producing prostaglandins, a natural fatty acid that's involved in inflammation control and smooth muscle contractions. During your pregnancy, the level of prostaglandins produced by your body gradually increases and then peaks when you go into labor. If extra prostaglandins are being produced in response to an infection in your gums, one theory is that your body may interpret this as a signal to go into labor, and your baby could be born too soon and too small. Preterm babies aren't as healthy as they could be. Complications caused by early delivery or low birth weight account for 60% of infant deaths. The good news is that an infection in your gums is an infection you can prevent by flossing daily, brushing at least twice a day with a soft bristled brush and a fluoride toothpaste. If brushing makes you nauseous, brushing with plain water and then rinsing with an anti-plaque or fluoridated mouthwash. And seeing us regularly so we can clean your teeth as needed and monitor the effectiveness of your dental hygiene routine. Researchers have discovered that if you have periodontal disease, you may have an increased risk of coronary heart disease and stroke. Periodontal or gum disease is an infection of the teeth, gums, ligaments, and bone that surround your teeth. Gums infected with periodontal disease are toxic reservoirs of disease-causing bacteria. The bacteria get onto the root surfaces of your teeth and cause pockets of infection to form. The bacteria hide and multiply in these pockets, resulting in tender, red, swollen gums that bleed when you brush or floss. Bleeding gums can create an open doorway that allows harmful plaque bacteria to enter your bloodstream. Severe periodontal disease can be compared to a 9-square-inch open wound around your teeth, offering significant opportunity for harmful bacteria to enter your blood. Some research has linked the bacteria associated with periodontal disease to the formation of blood clots that can block your arteries and even trigger a heart attack. These clots also cause fat-like substances to build up in the carotid arteries within your neck. Worst case scenario, if these fat deposits break apart and are carried away in your bloodstream, they can lodge in your brain, block a blood vessel, and cause a stroke. Additionally, some studies have also shown that when plaque bacteria enters the bloodstream through infected gums, you can develop a heart condition called infective endocarditis. This is a potentially fatal bacterial infection that causes the sac around the heart to become inflamed. So as you can see, it's vital to your overall health as well as your oral health to keep your gums healthy. If we determine that you have periodontal disease, we'll see you for frequent professional cleanings and will work with you to create a suitable at-home oral hygiene routine. When you're pregnant, you know it's vital that you take particularly good care of yourself, both for your own health and that of your unborn baby. What you may not know is that it's also important to be mindful of your oral health during pregnancy. Why? Because during pregnancy, your body produces higher levels of hormones, estrogen and progesterone. Elevated hormone levels cause your gums to overreact to plaque, the sticky film of food residue, saliva, and bacteria that's constantly forming on your teeth. As a result, your gums become more vulnerable to developing periodontal disease, an infection of the gums and bone that surround the teeth that, left untreated, can lead to tooth loss. In fact, some pregnant women develop a condition known as pregnancy gingivitis, which shows symptoms of swollen, red, and tender gums that may bleed when they brush or floss. Gingivitis is an early form of periodontal disease. Pregnancy gingivitis is most likely to appear in the second trimester and peak in the middle of the third trimester. If you already had gingivitis when you became pregnant, it's likely that the condition will worsen as your pregnancy progresses. Your pregnancy also puts you at risk for developing pregnancy tumors, which are large, non-cancerous growths around or between teeth that develop from swollen, irritated gums. Gingivitis can also affect the health of your baby. Excessive plaque bacteria can enter the bloodstream through your gums, travel to your uterus, and trigger the production of prostaglandins, a chemical in your body that is believed to cause premature labor. The result? Your baby could be born too early and too small. To keep plaque from building up and hardening on your teeth, you should clean your teeth after each meal, use dental floss, a toothbrush with soft bristles, and use fluoride toothpaste. If toothpaste makes you feel nauseous, you can brush with plain water and rinse with an anti-plaque or fluoridated mouthwash. We'll keep a close eye on your oral health throughout your pregnancy, cleaning your teeth as needed and monitoring the effectiveness of your home hygiene routine. Be sure to ask us if you have any questions about oral health during your pregnancy. A healthy mouth will help to ensure a comfortable pregnancy and a healthy baby. Wondering why you have persistent episodes of pneumonia or bronchitis? The answer may be hiding in your gums. Scientists have discovered a link between periodontal disease and respiratory infections. In fact, if you suffer from periodontal disease, you may be breathing harmful bacteria into your lungs every day from the infection in your gums. As you breathe in, these bacteria enter your lungs where they can breed and multiply. Evidence now indicates that bacteria in your lungs can lead to respiratory infections like pneumonia, bronchitis, emphysema, and chronic obstructive pulmonary disease. The main cause of periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. It needs to be thoroughly removed every day, or it builds up and hardens to form tartar, which is also called calculus. The blue spots here are tartar. There's no way for you to remove tartar at home. A toothbrush or floss won't even budge it. It takes a professional cleaning to get rid of it. If tartar isn't removed, it gets onto the root surfaces where it can cause pockets of infection to form in your gums, trapping bacteria. The bacteria, like the ones in this slide, produce toxins, and it's these toxins, combined with your body's reaction to them, that permanently destroys bone around your teeth. And now you know that these same bacteria can enter your lungs every day and may increase your risk of respiratory infections. If we determine that you have periodontal disease, we'll recommend an appropriate treatment plan, and we'll work with you to create a suitable oral hygiene routine. Prompt treatment of periodontal disease removes the source of bacteria, allows your gums to heal, and stops the progressive loss of bone. The added bonus? You'll increase your overall health and reduce your risk of respiratory infection, so you'll be breathing easier. Infective endocarditis is a disease that may damage the valves and tissues of the heart. It's caused by bacteria that enter the blood. Many common dental procedures, such as routine teeth cleaning, can cause minor bleeding that might allow these bacteria to enter your blood. For most patients, these bacteria are harmless. But if you have a medical history that includes a heart birth defect, prolapsed valve, rheumatic fever, endocarditis, heart surgery, or other problems, we need to take special precautions to protect you. By prescribing an appropriate antibiotic taken before your dental appointment, we can avoid the risks of endocarditis. If you have any drug allergies, or if you have questions or concerns about our procedures, please let us know. We want to protect you and keep your teeth healthy. If you have a history of periodontal disease, it's vital that we keep a close eye on the health of your gums so we can prevent a recurrence of this destructive infection. Periodontal disease cannot be cured. It can only be controlled. And if it isn't closely monitored and controlled, over time, periodontal disease can cause you to lose your teeth. Usually, if we're concerned about the depth of your periodontal pockets, we'll recommend periodontal therapy, called scaling and root planing, to remove infection from beneath your gums. Following this treatment, we'll have you come to see us every few months for ongoing care, which may include x-rays, a reevaluation of your periodontal health and the effectiveness of your home care, removal of plaque above and beneath the gum line, and retreatment with scaling and root planing if necessary. It's important that you know that periodontal disease is site-specific. This means that you may experience a flare-up of the infection in just one periodontal pocket out of the possible 192 that exist in your mouth. Bone and tissue loss might occur only in this isolated area, or it might be more widespread. Consequently, if we aren't checking regularly for this type of damage in your gums, you would have no way of knowing that it's occurring, and the destruction would continue unchecked. After we've treated your periodontal disease by removing plaque from above and below your gum line, we've disrupted the growth of the bacteria. Still, some do remain, and these may settle back into the pocket and once again begin the process of repopulating and destroying bone and soft tissue. Because the bacteria can reach destructive levels once again in as little as 90 days, the typical 6-month recare appointment just isn't safe for those who have periodontal disease. Statistics support that reevaluation and recare is critical at least every 3 or 4 months. More frequent visits help us break the stronghold of bacteria in your gums, minimize the recurrence of the infection, and slow or eliminate its destructive effects. 1/3 of the American population is affected by periodontal disease, a chronic bacterial infection of the gums, teeth, and bone that surround the teeth. Periodontal disease occurs when bacteria build up on your teeth and gums, causing your gums to become red and swollen. Left untreated, this condition, known as inflammation, eventually results in damage to the ligaments and bone that hold your teeth in place. This damage causes pockets to form around your teeth, and as the disease progresses and the pockets deepen, your teeth can become loose and fall out. In addition, periodontal disease has been linked to other serious health problems such as cardiovascular disease, osteoporosis, and diabetes. Fortunately, we now have a new effective treatment that helps us control periodontal disease and its destructive effects. It's called Arrestin, and it's used in conjunction with scaling and root planing therapy to reduce the number of harmful bacteria in your periodontal pockets and restore the area to health. This is a cartridge filled with Arrestin, an antibiotic in powder form. We painlessly insert the powder into your periodontal pocket, where it combines with moisture in your mouth and adheres immediately to the infected gum tissue. The individual powder particles, called microspheres, release a controlled, steady flow of the active ingredient minocycline, a potent antibiotic. As a result of this sustained release process, Arrestin works to fight your periodontal infection for at least 21 days. When used together with scaling and root planing, Arrestin significantly reduces the depth of the infected pockets and helps to prevent the progression of the disease. Arrestin has also been shown to be effective even in the most difficult-to-treat cases of periodontal disease, such as that experienced by smokers or those with cardiovascular disease. However, Arrestin's active ingredient is in the tetracycline family, so we won't use it to treat your infection if you are allergic to tetracycline or if you're pregnant or nursing. Periodontal disease is chronic, which means it can persist for a long time and may never be cured. That's why it's vital that we treat it aggressively so we can keep it under control. Arrestin is an important part of the overall periodontal therapy program that we have designed for you to prevent further destruction of bone and connective tissue and restore health to your gums. More than 75% of American adults over age 35 suffer from periodontal disease, a bacterial infection of the gums, teeth, and bone that surround the teeth. As the disease progresses, your immune system produces white blood cells to fight the infection. Unfortunately, the white blood cells release enzymes that destroy the soft tissue and bone holding your teeth in place, and as a result, your teeth may become loose. Left untreated, this destruction of supporting bone will eventually lead to tooth loss. Fortunately, we now have an effective treatment called PerioChip that we apply directly to the infected area. PerioChip fights periodontal disease and its tissue-destroying effects by reducing the number of harmful bacteria in your gums. This is a PerioChip, a biodegradable gelatin chip that's about the size of a baby's fingernail. It contains the antiseptic chlorhexidine, a time-released medication that's placed directly on the infected gum tissue, where it disintegrates and simultaneously releases the medication into the periodontal pocket, first in a larger concentration, then at a controlled rate for the duration of the treatment. This active ingredient greatly reduces the bacteria in the infected pocket and speeds the healing process. Unlike antibiotics, PerioChip does not produce bacterial resistance. It works by destroying the bacteria's cell wall. Depending on your needs, we can place up to 8 PerioChips during a single office visit. We typically recommend PerioChip treatment after we perform a procedure called scaling and root planing, and then again about every 3 to 6 months, for as long as periodontal pockets are 5 millimeters deep or more. Like other periodontal treatments, PerioChip can be administered directly after scaling and root planing. However, unlike some other treatments that contain antibiotics, PerioChip can be administered every 3 months for up to 24 months. PerioChip is not a cure for periodontal disease and cannot replace supportive bone that's often lost when the disease is left untreated. You'll still need to be meticulous about your daily oral hygiene and come to see us regularly for exams and professional cleanings. However, when it's used as part of your comprehensive periodontal therapy, PerioChip has been shown to be a safe and effective tool we can use to prevent further destruction of bone and connective tissue. Tens of millions of Americans suffer from periodontal disease, which affects the gums, teeth, and bone that surround the teeth. Periodontal disease begins with a bacterial infection. As the infection grows, your immune system is triggered to produce white blood cells to fight it. Unfortunately, as they fight the infection, the white blood cells also release enzymes that destroy the soft tissue and bone that hold your teeth in place. As a result, your teeth may become loose, and if left untreated, this destruction of supporting bone will eventually lead to tooth loss. Fortunately, there is an effective treatment called Atrodox that we can use to fight the bacterial source of periodontal disease and its destructive effects. This is Atrodox. It's an antimicrobial gel containing the broad-spectrum antibiotic, doxycycline. We apply Atrodox directly to the infected spaces between your teeth and gums. It then flows deeply into the periodontal pocket, where it hardens to a wax-like substance. As it sits in the pocket, it releases the antibiotic over a 7-day period. During this time, the antibiotic attacks the bacteria that are causing your periodontal infection, dramatically reducing their numbers. Treating your periodontal infection with Atrodox is quick and completely comfortable, and the waxy plug is absorbed by your body, so you won't need to come in and have us remove it. Scaling and root planing treatment is not necessary with each application of Atrodox, but we'll still use these treatments as needed to keep your periodontal disease under control. You'll also need to be thorough and consistent with your daily oral hygiene, and come to see us regularly for an exam and a cleaning to keep the infection in check. The active ingredient in Atrodox is in the tetracycline class of drugs, so it's not an option for you if you are allergic to drugs in the tetracycline family. Also, if you're pregnant or nursing, we won't use Atrodox to treat your periodontal infection, as tetracycline use can cause permanent tooth discoloration in your unborn baby. You should be aware that Atrodox is not a cure for periodontal disease, and once bone loss has occurred, no medication will bring it back. However, Atrodox is an effective additional method for us to use to help eradicate bacterial infection and prevent further destruction of bone and connective tissue. Sometimes your body needs the assistance of modern science to repair or heal itself. This is true in your mouth when you've lost bone from your jaw. In this situation, we can perform a surgical procedure called bone grafting, in which we replace missing bone with other natural bone or with artificial bone. A bone graft not only replaces some of the bone that's missing from your jaw, but it also stimulates your body to grow new bone tissue. The area from which the bone was lost is frequently called a bony defect. A bony defect may be a result of periodontal disease, tooth removal, trauma, a cyst, or long-term tooth loss. To place a bone graft, we first make sure the area is completely numb, and then we gently separate the gums from the bone or tooth. If a tooth is present in the grafting site, we'll use a process called root planing to remove all of the plaque or tartar from the root surfaces of the tooth. This ensures that the area is free from harmful bacteria. We then sculpt the surrounding bone to the desired shape and place the grafting material into the bony defect. We may use bone from several sources for your graft: your own natural bone tissue from another source, or artificial bone. After the graft is placed, your gums are then repositioned over the graft site and several sutures are placed. Over the course of 3 to 9 months, your body works to repair the grafted site, growing new soft tissue and bone. This new bone growth strengthens the area by connecting your existing bone with the bone material we placed during the procedure. Sometimes we'll take another step, called guided tissue regeneration. In this procedure, a special membrane is placed over the graft site to prevent unwanted tissue from growing into the graft site and to enhance normal bone growth. Bone grafting has many benefits: replaces lost or missing bone, fills in pockets of bone loss, and stimulates new bone and soft tissue growth. Though your body can't normally grow new bone on its own, new techniques and advanced bone grafting technology allow us to stimulate the regrowth of lost jawbone tissue, strengthen your tooth attachment, or fill in the pockets of bone loss caused by periodontal disease.